Thomas Smith arthritis is the sequel, it is the outcome, it is the complication of the septic arthritis hip joint which has happened during infancy. Investigation of choice, no doubt, is the MRI, but the investigation that you have to do in the emergency is the ultrasonography more commonly. Now, what is the best way of confirmation? Imagine you are presented with the condition. Suppose there comes a child who is febrile, who is having extreme painful condition of the limb. Then there are limitation of movement and there is a swelling present in the particular joint which is warm on feeling. It is warm as well as tender. Now, how will you confirm it? All you have to do is that you have to insert a needle in the joint, and if you can drain the abscess, it almost confirms that there is a septic arthritis, and you have to perform the arthrotomy as early as possible or as soon as possible. So best way of confirming is aspiration of joint aspiration. All these three lines are different. We have talked about the investigation of choice. It is MRI. It is the investigation of choice. But the investigation which you have to do in the emergency itself, it is the ultrasonography. But the best way of confirming is, or the quickest way of confirming is, that you put the needle inside the joint, aspirate it. If there is a collection of the abscess, the patient is suffering from septic arthritis. Next, it is a surgical emergency. It is considered to be a surgical emergency. Why? The reason are very simple. Just now we have talked about that, because the collection of the abscess or abscess within the joint will lead to a permanent destruction of the cartilage. Alright? It will be a permanent damage to that particular joint. So, surgical emergency is because the abscess, it leads to permanent destruction of cartilage. And because of this permanent destruction of the cartilage, it will result in the permanent deformity or permanent outcomes in that particular joint. And what is the management? It is very clear. All you have to do, you have to open the joint and drain the abscess, and then subsequently put the patient on antibiotics. Antibiotic regimen is the same as we have discussed in case of acute osteomyelitis, that IV antibiotics are meant to be continued for the period of 2 to 3 weeks, and following that, oral antibiotics are meant to be continued for the period of 4 to 6 weeks. Hopefully everything is clear related to this particular topic. Septic arthritis, how septic arthritis is different from acute osteomyelitis is only a simple way involvement. The primary involvement in case of acute osteomyelitis is the bone, while the primary involvement in case of septic arthritis is the joint. So hopefully everything is clear related to this particular topic. So once we have discussed everything related to this topic, it will become much easier for us to understand the essence of this question which was asked as a sample question, that 5-year-old male was brought to OPD after sustaining injury to his right knee. Now on examination, there was swelling, limitation of movement, fever, x-rays shows no bony fracture. What next? So, in both the cases of acute osteomyelitis as well as in case of septic arthritis, that means primary infection of the joint, you have to confirm that what is the location of the abscess. Is it intra-articular or extra-articular? So in this case also, you have to perform the ultrasonography as early as possible in order to have a location confirmed. So start IV antibiotic and get the USG done. So the same question we have talked about in case of acute osteomyelitis also. Like in case of acute osteomyelitis, what we have talked, that ultrasonography is the requirement to locate the abscess, that whether it is present inside the joint or not. So same is the question, and the answer remains the same, that it is USG that you have to go for. Next is Tom Smith arthritis. Is it the septic arthritis of the hip joint in infancy? Is it the septic arthritis of the hip joint? Just simple. Septic arthritis of the knee joint in infancy, septic arthritis of the knee joint. Now, in both the ways, it is correct that it is the septic arthritis of the hip joint which has happened during infancy. Alright. But, septic arthritis of the knee joint is incorrect. And it is the septic arthritis of the hip joint also. So, out of the two options, which one is correct? It is actually the septic arthritis of the hip joint. Not in infancy, because in infancy, during infancy, the infection has happened, but it is the outcome of the infection which has happened during the infancy in hip joint. So hopefully you have understood the answer for this question, that it is the septic arthritis of the hip joint. Simple at present. Next is, which of the following is the most common type of the tuberculosis of the spine? Paradiscal is the answer for this question. Next is, what is the treatment of the Pott's spine D8, D9 without if the patient is not having any neurological deficit, then what should be the management? This is another sample question. Third one is, 23-year-old female came to OPD with a complaint of pain for the last 5 months. There is a history of progressive pain, which is more at night. persistent fever and the weight loss. So these are the constitutional features which will always be presented to you when the examiner is asking anything related to the tuberculosis. On examination, tenderness near thoracolumbar region, SLR was found to be 80°, brisk reflexes in the knee joint and the ankle with the extensor plantar reflexes. X-ray shows reduced disc space between T10 and T11. What is the most probable diagnosis the patient is suffering from? All right. So this is all what we are going to discuss in the next segment of the topic, that is Pott's spine. Pott's spine obviously is the tuberculosis of the spine. You know, out of all the musculoskeletal tuberculosis, it is the spine which is most common site to be affected. So the question number 1, that what is the most common site? Obviously, within the spine, what is the most common site? The most common site is thoracolumbar. Thoracolumbar is the most common site. All right. You know, if I say that thoracic spine is the most common site to be affected, that is not true. If I say lumbar spine is most commonly affected, that also is not true. Previously, it was clearly mentioned that thoracic spine is the most common site to be affected. But nowadays, because of the higher use of the investigations, we are finding that it is the lumbar region which is equally affected as thoracic region by tuberculosis of the spine. All right. So lumbar region is also very commonly found to be affected. So thoracolumbar, both of them is the correct answer for that particular question. Now, it is always a secondary infection. Now, what do you mean by the term secondary infection? You know, the primary infection was happening either in lungs, it could be alimentary canal, it could be renal system. That means primary infection is there in any other region of the body. But then it led to a secondary spread into the vertebral column, which leading to the tuberculosis of the spine or the Pott's spine, which is considered to be a secondary infection. All right. Now, what are the roots which are responsible for causing this Pott's spine? One of the root could be, now as far as roots are concerned, the most common root obviously is hematogenous. That means through blood stream. So hematogenous is considered to be the most common route. Second is lymphatics, and there is always a possibility of a direct spread. So it can directly involve the vertebrae also. That means the Ghon's focus, that means the primary tubercular focus within the pulmonary region, it might directly spread to involve the thoracic vertebrae. So direct spread is also a common possibility, but the routes of spread are hematogenous, the lymphatics, and the direct spread. So these are the two things. First is the most common site, which we have already talked about, thoracolumbar, and the second one is the it is always a secondary infection. Now, point number 3, that what are the different types of the tuberculosis of the spine? You know, the most common type is paradiscal. Paradiscal is the most common type. Now, what happens in paradiscal? Para, as the name indicates, adjacent to. All right, para means adjacent. So there will be involvement of the intervertebral disc. Imagine these are the vertebral body and this is intervertebral disc. So there will be involvement of the intervertebral disc and the adjacent vertebral bodies. All right, end plates of the adjacent vertebral bodies are going to be affected because it receives the innervation of a single blood vessel. This region of the vertebrae, this much region of the vertebral column, it receives the innervation from a single vessel. So when that vessel is infected, it will lead to the infection of that disc and the adjacent vertebrae. All right. So paradiscal is the most common type. Second is central type. You know, central is the second most common type. Now, what is the difference in between central and paradiscal? In the central type, there is a primary involvement. That means initial involvement will be there in the vertebral body. So primary vertebral body involvement. It will be a primary vertebral body involvement. All right. There will be involvement of the vertebral body first. Now, over a period of time, what will happen? That this, with the spread of the organism or with the increase in the virulence or increase in the infective pathology of that organism, it will lead to the encroachment and it will also involve the vertebral, intervertebral disc and the adjacent regions. But the initial involvement, the primary involvement was there in the vertebral body, that is central type. Then the third type is the anterior type. Now, what happens in case of anterior type? There will be a prevertebral abscess. There will be a prevertebral abscess formation. Imagine this is the vertebral body, these are the vertebral body, and this is the abscess which is located just anterior to the vertebral bodies. So prevertebral abscess is the primary abnormality in these cases. And finally, the fourth type is the posterior type. Now, in posterior type, everything else which is left could be affected. You know, what is left now or what has involved? What we have already talked about the involvement of the vertebrae or vertebral column. We have talked about the involvement of the vertebral body. We have talked about the involvement of the intervertebral discs. We have talked about the involvement of the anterior column of the vertebrae. Now, what is left? The things which are left are to be affected in case of posterior type of the or the appendiceal type of the tuberculosis of the vertebrae or tuberculosis of the spine. Now, this posterior type of the tuberculosis of the spine could be categorized or could lead to the involvement of, what is happening in posterior type. There could be an involvement of the transverse process. There could be an involvement of facets. There could be an involvement of spinous process. There could be an involvement of lamina and pedicles. So anything could be affected. Alright. So this is posterior type. Now overall, out of the 4 different types of tuberculosis of the spine, the posterior type is the least common site to be affected, or it is least commonly affected, or it is the least common type of tuberculosis of the spine. Now, if you look at the vertebrae, now this is the vertebral body and this is the canal and these are the posterior processes. This is transverse process, for example, and this is the spinous process. All right. And posterior to that, we are having a lamina. All right. And these are the pedicles. Now, if this is the vertebral body, then all these things are likely to be called as appendages, because if there is a trunk, then all the limbs are said to be appendages. So this posterior type, and that is the reason this posterior type is also known by the name of appendiceal type. So it is appendiceal type of the tuberculosis of the spine. Now, out of these 5 structures that could be affected in posterior type of the tuberculosis of the spine, the least common site to be affected is the articular facets. All right, this is the least common site to be affected. And if articular facets are not there in the option, then the second least common site to be affected are the spinous processes. So hopefully everything is clear related to the types of tuberculosis of the spine. Just have a discussion again. The types of tuberculosis of the spine, the most common type is paradiscal. You came to know the reason. Second one is central. The third one is anterior, and the fourth one is posterior. In the posterior, we have discussed what are the different structures that could be affected and why is it called as appendicular type of the tuberculosis of the spine, and within those posterior structure, which structure is least commonly or least likely to be affected by this tubercular organisms. So